So for 18 months, the people of Flint were drinking corrosive water. The water was so corrosive, it actually ate up engines in GM's car plant.
I told you a few episodes ago that you'd be hearing more about the city of Flint, Michigan, and the water crisis that impacted its residents. Well, today is the day. Hi there, it's Rhoda, and I'm back for episode 31 of the Assyrian podcast. Today's guest is a pediatrician, professor, public health advocate, author, and also one of Time Magazine's 100 Most Influential People. Dr. Hanna Attisha, or more commonly known as Dr. Mona by all of her tiny human patients and colleagues alike, is the pediatrician that exposed the water crisis in Flint. She grew up in a family that mainly spoke Arabic at home, but her father has done some extensive work on their family tree and has recently discovered a whole Assyrian ancestry in their family that I got to talk to Dr. Mona about. We also talked about the city of Flint, her work as a pediatrician, leadership, service, and her book, What the Eyes Don't See. I really enjoyed her book and love the way she weaved her family story into the story of Flint. I hope you get a chance to read it too. Before we get any further, though, I have a disclaimer. The past 30 episodes have all been recorded in person. I know the sound quality hasn't always been perfect because of the acoustics of the different rooms and other contributing factors, but we've tried to record interviews in person because we know that gives us better sound quality. I was not able to meet with Dr. Mona in person, and so this interview was recorded via Skype. You might be able to tell the difference, but we thought the content of the interview was important enough that you'd still be able to enjoy it and gain something from it. Thank you for always listening and following us on social media. Be sure to subscribe to the podcast and tell your family and friends about us. I continue to meet so many Assyrians who haven't heard of the Assyrian podcast, and it's always so fun to show them how to listen and keep up with new episodes. And thank you for your continuous feedback. We appreciate it so much. Speaking of appreciation, I'd like to thank Tony Caligarakos and the Injury Lawyers of Illinois and New York for sponsoring this episode. If you know anyone that has been in a serious accident, please reach out to Tony Caligarakos. Tony has been recognized as a top 40 lawyer and a rising star by Super Lawyers publication and has obtained multiple multi-million-dollar awards. Tony can be reached at injuryrights.com or 847-982-9516. And now, without further ado, here's Dr. Hanna Attisha. Dr. Mona, welcome to the Assyrian podcast.
Thanks for having me. It's great to be with you.
I want to ask you all about your book and Flint, but first I want to ask you a little bit about yourself. I know that your parents were born in Iraq, but you weren't. Can you talk a little bit about where you were born and how you ended up settling in Michigan?
Absolutely. So I was actually born in Sheffield, England. My parents left Baghdad about a year prior and went there for my father to complete his studies. He was getting a PhD in metallurgical engineering. So my brother, who was just a year older than me, was actually born in Baghdad, and then shortly thereafter they moved there for his studies. So we lived there until about the late 1970s. The plan was to go back to Iraq. That was home. That's where all of my extended family was. But at that time is when Saddam Hussein was rising in power, and my parents knew that with two small children, they could not go back home. They were very acutely hearing and seeing stories of his tyranny, his fascism, his oppression, his dictatorship. So it was really at the beginning of the Iraqi diaspora, and we immigrated to Michigan, where most of Arab Americans are outside of the Middle East, but also most Iraqi Americans. So we came here when I was about 4.
Your mom was also educated in Baghdad. She was a chemist, right? Can you talk a little bit about that?
Yeah, so both my parents grew up in Baghdad. They had done their initial studies there. And my mom also went to college there at Baghdad University. She was a chemist, one of only 2 chemists in her class at the time. And I love going through her old pictures in the 1970s in Iraq. And I swear you could put those pictures next to, UC Berkeley, and there are lots of folks in short skirts and really progressive, really diverse. Her best friends were of all kinds of ethnicities. They were Muslim, and they were Iraqi Jews, and they were Christian, and it was a time of very kind of progressive thinking and progressive values, and that is the Iraq that my parents remember, and really that's the last time that they were there.
I have seen a lot of publications refer to you as an Arab American. I've also, in your book, you talk about the fact that your family's part of has been a part of the Chaldean Church. You also talk about your Assyrian ancestry. I'm curious how you self-identify.
Increasingly in our community, there's been a lot of kind of division and divisiveness, or you're this and you're not this and you're this if you came from this. And I am everything. I grew up and Arabic was my first language. I relate to that culture, that food, that part of the world, that people. And, it's a special connection when I hang out with friends who are Palestinian and Lebanese. There's shared cultures and there's shared values. But I'm also an Iraqi Christian, so we're Chaldean, and have this amazing ancestry that we recently discovered that traces back centuries of Iraqi Christians, Chaldeans, Nestorians who actually wrote down the traditional Aramaic. So I am part of all of these things, and I think it's ridiculous for us to divide ourselves and say we're not this and we're not that. It makes us come across as arrogant, like one is better than the other, and that is not how I was raised. I was raised to really believe in the value of all people and what different folks bring to the table.
You are a pediatrician. Did you always know you wanted to become a pediatrician?
I think it just was a perfect fit for me. I knew I wanted to serve. I knew I wanted to give back. And I knew that advocacy would always be part of my career. And to me, pediatrics fit all of that. It was being in medicine is really the most intimate form of service. And then in pediatrics, so much of what we do is prevention. And also so much of what we do is advocacy, is speaking up for children. So it was just a perfect fit for me. Also, I'm honestly like a kid that has never grown up. So and being a pediatrician and hanging out with children enables me to stay that kid, because like watching cartoons is like work, and the kids inspire me. Whenever I hang out with my kid in the clinic, it keeps me going.
Let's talk a little bit about Flint. Flint has been a household name the last few years if you are in the United States, but we have a lot of listeners who are from Europe and Canada and Australia. So can you talk a little bit about Flint as a city, where it's located, what are the demographics, and then what happened?
Yeah, so Flint is an amazing city with incredible history. Flint is the birthplace of cars. General Motors was born in Flint. And really, even more importantly than being the birthplace of cars, Flint is the birthplace of resistance, and arguably the birthplace of the American dream. It was because of really brave and courageous auto workers who literally sat down and occupied car plants in the 1930s that we have unions, and we have the UAW, and we have the benefits and the wages that so many people are now part of in the United States. So Flint has this absolutely incredible history. At one point, Flint had the highest per capita income in the country, which is so hard to believe. But people in Flint made the most money of anywhere in the country. And because of that, people moved to Flint. So large population of immigrants from the Middle East, very large Assyrian population as well, from Europe came to Flint for great living wage jobs, as well as African Americans as part of the Great Migration North. So Flint was the definition of prosperity. And not too long ago, like 1970s is when we had the highest wages in the country. But since then, Flint has suffered really from decades of crisis. The water crisis is on top of decades of crisis, which began with disinvestment, which led to unemployment, poverty, racism, population loss, decline of unions, crumbling schools, violence, you name it. Flint is riddled with all of these toxic stresses that affect children's development. Because of this financial state, the city was in near bankruptcy. and thus was taken over by the state. In Michigan, there was a policy driven by austerity, which was to save money, that took over democracy in certain cities. So the state took over the city, appointed an emergency manager whose only goal was to save money, and they decided that the water that we had been getting from the Great Lakes, which we had been getting for over a half a century, which was fresh, pre-treated water, was too expensive for this poor, predominantly minority city. And instead, we started drawing water from the local Flint River, but that water wasn't treated properly. So for 18 months, the people of Flint were drinking corrosive water. The water was so corrosive, it actually ate up engines in GM's car plants. So just a few months into this water switch, GM noticed that their engine parts were corroding, and they switched back to Great Lakes water. But the people of Flint were told to relax, to continue drinking this water. The corrosive water ate up the pipes that was in this aging infrastructure, and the pipes are made of lead, and that lead got into the drinking water, into the bodies of our children, and that's where I got involved, really exposing the research that the lead was increasingly in the bodies of our children.
And so you found out about it and did your research, and you would think the city and the state would spring straight into action, but that's not what happened. Can you talk about that?
Yeah, that's not what happened. So I shared this research. I shared science, facts, evidence. You think that people would believe facts, but we're very much in this era, increasingly now, of fact and science denial. And like everybody else who brought up concerns about this water, I was also attacked. The science was attacked, as well as my credibility. But then we fought back. We fought back with more evidence, with more science, and ultimately it was our loudness, our persistence, and our science that spoke truth to power, and the state finally conceded. And really, since that point, we have been on a path to recovery.
What is the current state of water in Flint?
That's a great question. So the year and a half that we were on this untreated corrosive water ate up our pipes. So those pipes are being replaced, and that takes time. So we are about halfway through this pipe replacement process, and until those pipes are replaced, people still need to be on filtered and bottled water.
And I know that there are currently investigations going on to figure out what happened. What do you hope these investigations uncover?
Yeah, there's lots of efforts at accountability. There's been many investigations by lots of different folks, the Civil Rights Commission, the EPA, the Attorney General's office, as well as criminal charges that have been brought up against lots of the folks that were involved, including homicide charges. We talked about lead, but we also had deaths because of Legionnaire's disease, which was also caused by this untreated water. What I hope that all of these efforts at accountability get at is justice. There needs to be justice so that the people of Flint can really move on. I think of it as almost a truth and reconciliation process. And when you have these efforts at accountability, at restorative justice, you can really move on to that long process of reconciliation.
How long did it take for Flint to get national attention?
How long did it take Flint to get national attention? It took a long time. And there's been many reports at why it took so long. Why wasn't the national media on this story? When water comes out of the tap that's brown, why didn't people pay attention? And many of the folks who've investigated that issue and the issue by and large really point to this as being an environmental injustice. It was because of the demographics of the population, poor minority community, that they were largely ignored and people closed their eyes, which also gets at the title of my book. The title of my book is called What the Eyes Don't See. It's very much about lead and water. Lead and water is invisible. It's about the impacts of lead, which are known as a silent pediatric epidemic, but it is so much bigger than Flint. It is about people, it is about places, and it is about problems that we choose not to see, that we just close our eyes to. Flint was purposely neglected. People didn't want to be aware of that problem. And then kind of my story and the story of the book is that we need to open our eyes. We need to be awake to these injustices. And they're not just in Flint, they're all over the nation, world. They're right outside our backyard, and we need to be awake to them, and then we need to act on them.
I'm glad you mentioned the title of your book, because I wanted to ask you, why is the book called What the Eyes Don't See? But I think you just talked about that. As I was thinking about the title, I was trying to think of little stories that you talk about in the book that also apply. I thought of the scar you talk about on your forehead, which is also something.
You don't see it. It's right
you
there.
Don't see it. And I also thought about your dad listening on his radio to stories about Iraq. His eyes couldn't see what he wanted to know, but he was just finding ways to know more. So
You got it.
yeah.
There's so many meanings of the title, and you definitely picked on more. It's also about my immigrant status. When you see me, when you look at me, you also don't know that history, that background, that social justice background, really kind of, with generations of folks who are always fighting to do the right thing. But yeah, the title means a lot of different things. It also speaks to our blindness in medicine. We are very myopic. We only see what's in front of us, and we fail to see what's happening at a population level. So yeah, there's a whole list, and a book club can dissect all of the meanings of the title.
Let's talk about the narrative structure of the book, because one of the things I enjoyed the most was that, I feel like you could have just told the story of what happened in Flint, and that would have been an interesting memoir, but you chose to talk about your family's history extensively.
Mm-hmm.
Why did you choose that narrative style and structure?
That's a great question. So I think it would have been it would have been easy for me to just talk about Flint and to talk about what happened, and that would have been timely and it would have done well. But I'm not really, I don't really take the easy route. I took a risk. To understand my role in Flint, how I got there, and what I did, and why I did it, you have to know who I am. So this book is very much a memoir. And that immigrant story is a big, like you said, is a big part of this book. And I don't think it would have been as big a part of this book if it wasn't for the last presidential election. I wanted people to see a positive immigrant story, especially from our part of the world, where increasingly, we are closing our doors to people just like me. I mean, when I was 4, Lady Liberty welcomed her arms and opened me into this country. We were, basically fleeing oppression and tyranny and dictatorship, and looking for that American dream, looking for opportunity and freedom and democracy. And it was realized for me. And as a result, I grew up competent and confident and proud of the diversity that I brought to the table. And you have to question what we are doing and what we are missing out on right now in this nation. So that needed to be part of the story. You also needed that perspective to understand the lens that I see the world in, because I see the world with this lens of being everyday grateful to be in this country, being lucky and privileged to be here, because really a split-second decision, I wouldn't be here. I'd be like my cousins who are back home. But it's also a perspective that acutely knows what injustice is. Like I say in the book, my parents never shielded us from what was happening back home. There's images of, for example, Halepcha, the first time I saw a dead baby, where I realized what people in power could do to vulnerable populations. So I grew up with this lens of knowing what injustice was, and because of that, really dedicating my life to fighting against that, and almost having this heightened antenna that of knowing what it could be, and being aware of it, and making sure it doesn't happen.
The other thing that narrative style showcased for me was that humans can be connected to each other through so many different ways, that a daughter of immigrants from Iraq could find similarities between her own story and the story of people in Flint. And it got me wondering about our community and how our own oppression and suffering should, you would think, soften our hearts to the suffering of other people. Do you think that's true? And do you see that being a part of what people in our community experience, and should they?
I think we come from a place where we acutely know what discrimination is. We acutely know what it feels like to be part of a vulnerable minority. We acutely know what injustice is. And, we have that same perspective of being fortunate to be in a place, that has that freedom. For me, and for so many others, that's what's pushed us to, commit our careers to serve, because of that background. And that's, and that is the story of America. It's these immigrants who've come and made this country a better place because of what they've been through. So I hope that those lessons translate to our larger community. And I think that they do. And that's the message that I hope to share, is that of a borderless cause. And this kind of reminds me of the story in the book about my great uncle Nuri, who went and fought in the Spanish Civil War, like one of two Iraqis who went to fight against Nazis and fascism in the 1930s. Like, I love this story because it wasn't about a religion or a race or even a country. It was about this bigger concept, these bigger values of peace and justice and freedom. And that's how I see my work, and that's how I hope everybody sees their work. That it's not, it's not, this religion, this race, this country, these people. It's about humanity, human race. And I think if we kind of put down those barriers, maybe we would be more empathetic to the suffering that is happening in our own communities, regardless of who those people are and what they look like. They're that's part of our civic responsibility. That is part of our job as humans, is to care and provide for each other. And for me, it doesn't matter where I am or who they are. My kids in Flint are no different than my children. I treat them the same.
You talk a lot about different kinds of leaders in your book, too. You mentioned Saddam, for obvious reasons, Governor Rick Snyder, the current governor of Michigan. Your grandfather stood out to me as a leader in your life and your family. He named you. There are other stories about his leadership. I'm curious what you have learned about leadership the last few years.
I think what I've learned and what I've tried to espouse is that, is the role of a servant leader. That, you are a leader to serve. And if you have the skills that enable you to lead, that it is for the benefit of others. So that is kind of how I espouse my role in leadership, how I've tried to be a leader in my work and in my community, but also how I've seen other leaders. It's about being a good listener. It's about, caring for all. The story of Flint is a story where people who are poor and minority didn't have access to clean water. That's we don't want to be a society anywhere where the privileged have different things than the non-privileged. So it's leading with equity and compassion, but also, leading with a mindset that recognizes history. So there's a lot of history in my book. The history of, for example, the place I grew up here in Michigan, Royal Oak, which used to have like this Nazi priest and then, the history of Flint that had underlying racist policy. So the history of lead, the history of public health, there's a lot of history in the book. And it's not like boring history. It's page-turning, exciting history. But we need to know the history of the places that we walk through, because without knowing that as a leader, you can obviously repeat some of the same mistakes, but you fail to acknowledge the past and what happened and remedy what happened. So our one of our big initiatives in Flint right now is this registry, where we are identifying folks who are exposed and getting them connected to resources. So a community member selected the logo of this registry, and it really kind of speaks to all of this. It is the mythical African bird. It's called the Sankofa bird. And this bird is flying forward, yet looking back and holding an egg in its mouth. So it is this concept that we always have to push ahead. We always have to, go forward. Yet we cannot forget our past. We cannot forget where we came from and our roots, and be proud of those roots. And the egg in the mouth is, we have to prioritize the young and the kids. So I think that's kind of symbolic of all of this, and especially as a leader, like we need to go forward, but we cannot kind of whitewash or be blinded to our past, and it's always the kids.
I'm curious what your experience has been in the ways that you have led the people who work with you and for you over the last few years as a woman in a leadership role. What has that been like for you?
In my discipline in pediatrics, it is women, female predominant. Not in all of medicine, but pediatrics is. And I've never really let my gender play a role in anything. I was raised to be loud and to be stubborn. And especially in our culture, so often it's like, oh, girls can't do this. We're not sending our girls to college. And my parents did not believe that. Like I said, my mom was one of two women in her chemistry class. She went away to college. So when it was time for me to go to college, she's like, yeah, absolutely, you're going away to college. Like, I would love you for you to stay home, but you're going away. So, I've been blessed to never have some of those cultural, even those, where that I've been restricted in that capacity. So, so often, I don't even see that. However, it definitely has played a role. There's a part in the book where I mentioned that so often in pediatrics, I'm used to like dark women in white coats, and in this crisis, I was often surrounded by like white men in dark coats or in dark suits. I've been proud of that. I've been excited to be able to kind of push through, and to be a strong woman leader, especially in our community.
Speaking of the white coat, the part that you talk about kind of donning the white coat and like feeling that sense of authority that it gave you, I was describing this to my husband and he said, "Oh, like Bruce Wayne. He's not Bruce Wayne anymore when he puts on the cape. He's Batman."
Totally.
The water crisis in Flint and the work that you've done has brought you to the forefront of the nation's attention in some way. You were named as one of Time's most influential people. You have a book that the New York Times and the Washington Post have written reviews on. What sort of opportunities has this presented to you to help other disenfranchised people on a larger scale?
You got it. So I have been blessed and privileged to have this amazing microphone, to have this larger platform, especially with writing a book. And the whole purpose of all of that is to share a message and to share a story and to impact the lives of more children. Flint, this book is not about just Flint. It is about so many other bigger issues that are facing children all over this world. We have too many kids who are living in very similar toxicities, be it poverty, racism, discrimination, violence, incarcerated parents, you name it. And all those things impact children. So I will hold on to this microphone. I will stay on this stage as long as I can to be able to impact the lives of more children. So I'm very privileged, and I realize how lucky I am. And I'm excited to share that message. And, a lot of the accolades and the awards are very awkward because I continue to really express that this is part of my job. This is part of my job as a pediatrician, is to advocate for children and to care for these kids. I literally took an oath to protect children. But part of writing this book is also to challenge everyone that we all took an oath. All of us as humans have that very civic responsibility to protect children. And that's another one of the messages I want to share. And it's also all these, accolades, like I said, are also quite awkward. But if I can, inspire another young girl, a girl who is maybe a person of color, maybe from our own background, a girl that can also believe in herself and believe that she can change the world, then it's all worth it.
There's one person in particular I want to ask you about that you talk about his story in your book, and that is Dr. Paul Shikwana. Can you tell our listeners who he was and what he did?
Yeah, so this is an amazing story. So you all need to read it in the book. But in short, he was probably at that time epidemiologist, infectious disease expert, bacteriologist, whose gravestone actually said he was born in Assyria. So it wasn't even present-day Iraq. In the early 1900s, he came to the U.S. via England to be a public health warrior. So he immediately came, I think in like 1904, to Washington, D.C., to George Washington University, and then quickly was sent to Iowa to fight the plague, and has published articles in medical journals. He was so famous, almost all of his travels were documented, for example, in the Iowa newspapers. And he actually he talked about the importance of hand washing, water quality, milk pasteurization. Like, this guy was a legend. He was an absolute public health champion. And it's hard to believe that there's any Iraqis in Iowa now, but to imagine Iraqis in Iowa in like the early 1900s is amazing. So I think it's such important history for our community to recognize that we have been making an impact in the world for a long time. And he's like I don't know, my dad has the whole kind of genealogy, but like he might be a great uncle, like 10 times removed or something. But his story is just incredible. because my father dug and dug and found out more about his story, and we've recently created a scholarship a few years ago in his name to give to graduating high school students who want to pursue who want to go to college. But it is an amazing story. He's very sadly tragically died very young in a train accident, or a train hit him as he was I don't know, fishing or something. But an amazing, amazing public health pioneer in the early 1900s in Iowa from Assyria.
Yeah, that's actually the reason why I know about him. I knew about him before I read his story in your book, because I've seen a picture of his tombstone where it says "born in Assyria," and so when I read about him in your book, I was happy to know more about his. That was one of my favorite stories. I was so glad you talked about it. You mentioned earlier about people in your family, along with Dr. Paul Shikwana and the other great uncle, who have been in line of basically serving other people. You've also talked about people in your ancestry who've been priests and part of both the Catholic Church and Assyrian Church of the East. And I'm curious what it feels like for you to be a descendant of people who have left that kind of legacy, not just in your family, but the world at large.
Yeah, no, I think this is what I share to my young daughters is to be proud of where you came from. You came from really awesome people who were leading the way. They were blazing the trail, and doing really incredible things. So definitely sharing that oral history, sharing whatever we have about these amazing ancestors, because it only makes us stronger. It enables us to realize that that we have a power within us that is almost intergenerational. That sometimes we don't think we can do great things, or it's scary and it's hard and there's no way I can do this. Nobody's ever done this before. But to know this history enables all of us, because it's a shared history. We're all cousins. To enable all of us to have that bigger impact.
Your family has this great tradition of storytelling that you talk about in the book, about people that we've just talked about in your family. What is the story that you hope your great-great-grandchildren hear about you?
Yeah, so I hope they just read my book. And that's kind of why I write the book, is to document these things, for my kids, and for their kids and their kids after that, so they can hear some of these great stories and hopefully really commit their lives to serve. These stories it's not about me, it's not about my ancestors, it's about them and what they can contribute to their communities.
Well, that's it for this week. Thanks for listening. You may have noticed some changes to our logo, and we'd like to thank Eva Toma for designing the logo and Jessica Laudu for the new graphic text. I'd also like to give a shout out to Stephen Lelham and Tanya Daniel for the new format of the logo. We'll be back next week with a new episode. Until then.